everyone, I'm Crystal Cruz. A single fully vaccinated person has died at Medical Center Hospital. That's a scary headline, and it needs some context. The patient was in their 80s, living with pre-existing conditions. The most vulnerable and the most likely to have a low immune response to the vaccine. Here's where the story is, and the fact remains. People who are vaccinated aren't the ones overwhelming the hospital. Like a healthy 29-year-old who came in with COVID and was unvaccinated and died. Medical leaders wish these statistics would resonate more with our community. NewsWest 9's Sammy Steele joins us in the studio with more details on this. Sammy, this is just sad.
I mean, it really is, Crystal. The message, it hasn't changed. Hospital leaders, they continue to plead, get the vaccine. As hospitalizations grow, it feels as if that plea, it's falling on deaf ears. Tonight, 9 out of 10 of those in the hospital with the virus have not been vaccinated. And the hospitals don't have enough staff or room to keep up at this rate. Now it's a matter of convincing those who just don't believe the data. Walking through Midland Memorial and Medical Center during this COVID wave, you'll hear the same question being asked by doctors and nurses to their COVID patients. Did you get the vaccine? Yeah, we've got those. 90% of the time, the answer is no.
When you spend your whole day dealing with patients who have made choices that have landed them in the hospital when there were alternatives available, it taps some of your energy. It makes it much more difficult.
We definitely believe the vaccine gives you a better chance of survival and probably lowers your risk for hospitalization. That I think that it just emotionally and mentally wears our staff down.
Right now, just under 40% of the population in Midland and Ector County is vaccinated. As to why, Dr. Wilson points to misinformation, something proving to be just as contagious and dangerous as this virus.
Think about the people that you've trusted for your information. Maybe they've been really good sources of information for all the normal things that have gone on in life for all of us that have been very, very normal things going on for years and years. But this is not normal. This is a novel virus. It's behaving differently than anything we've seen since 1918. Nobody alive today that you're going to be having a conversation with has experienced anything like this before.
Here's the thing with the vaccine. It doesn't prevent the disease. It gives you a fighting chance.
Those that are vaccinated aren't getting as sick. We haven't had a death amongst the people that are vaccinated in our community. And I've just mentioned we've had 13 so far this month.
If you look at how many sick people we've had since COVID began, that only one has expired who was vaccinated. I think that speaks volumes, especially when you look at pre-existing conditions, other illnesses, other situations going on in that person's life.
And like I said, the vaccine, it doesn't prevent the disease. It gives you a fighting chance. And now that third booster shot of the vaccine, it's going to be offered to Americans, hopefully starting in September. But the hospital, they tell us that they are both working on distribution plans. They will release details on how the public can sign up for that third shot later this week. Crystal.